Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and today we are going to be talking about the Tennessee Breast and Cervical Cancer Grant that West Tennessee Healthcare and the Madison County Health Department are involved with. Joining me is Adora Butler. She's an LPN, and she's the Tennessee Breast and Cervical Cancer Screening Program Coordinator for Madison County. She's here talking about this. So, Adora, kind of first off, how are you today?
I'm good. How are you?
I'm good. So tell me a little bit about the grant, the Tennessee Breast and Cervical Cancer Grant. What is that, and how did that become a thing?
So it's actually been around longer than TennCare's been around.
Okay.
So it's been around for a really long time. It is aimed to help women and men, because believe it or not, men get breast cancer. It's to help them with early detection and screening procedures that women and men need,
Okay.
such as like mammograms, pap smears, all of that lovely women's health stuff.
Okay, well, so tell me what qualifies someone to enroll in this program.
So, like I said, you could either be woman or man. There is an age requirement. So, for the breast part of it, it is 40 to 64
Okay.
and be uninsured. The cervical part of it is 21 to 64 and be uninsured.
Gotcha. To be involved with this, do I have to bring in proof of an income or a lot of paperwork in order to qualify?
No, the state of Tennessee actually recognizes your verbal consent that this is what you bring in monthly, and that's all we need. We don't need any paperwork. When patients call in, I ask them about 10 questions. It takes about 30 seconds
Okay.
to see if you qualify. You know that you qualify as soon as you answer my questions. I can tell you.
What are those questions that will be asked?
We need some personal information like name, date of birth, social, address, then your monthly income, and how many people live in your home.
Okay.
And then we get into more personal questions like, are you having any symptoms with your breast? When was your last mammogram? When was your last pap smear? All that lovely stuff.
Gotcha.
Do you have a family history of breast or cervical cancer? And then we go from there.
Okay.
So if you do qualify at that point, then I can get you set up with one of our providers that are here in Madison County that will see you and take care of your treatments.
That leads me into my next question. So is there a particular clinic that I have to go to, or do I see any doctor or a specific doctor you tell me to go see?
So we have a partnership with Christ Community right now.
Okay.
And they're actually getting ready to have an OBGYN department that's coming up. So it's kind of a one-stop shop there. They can order the mammograms, they do the pap smears, the labs, and say your pap smear did come back abnormal and needed more testing. They're going to be able to do that there. But right now we have Dr. Ball and Dr. Wilson at West Tennessee Medical Group OBGYN specialist that we deal with. We have a relationship with all West Tennessee healthcare clinics. They all see our patients.
Okay.
The imaging center takes our patients, the hospitals, all West Tennessee healthcare takes our patients.
Gotcha.
But right now we are working on some other facilities to see if we can get our patients enrolled in there. But right now, Christ Community and UT Family Practice are what we have right now.
Perfect. So do I need to be experiencing any problems in order to sign up for this, or can this be some sort of like preventative measure?
No, this is a screening program.
Okay.
So you don't necessarily have to have any problems, but say you're outside of that age requirements. If you do have a problem, then you can qualify even though you're not in that age range. So say you're a 40-year-old male, you found a lump in your breast. Okay? You'll qualify because of that. Say you're a 24-year-old male, found a lump in your breast. You would qualify.
So would I need to go to see my doctor first before I come to you guys, or?
You can either schedule an appointment at Christ Community because they can enroll you, or you can call me on my office number and I can enroll you.
What's that number for?
It's 731-541-4161.
Okay. So what if the doctor finds something and needs more testing to be done? Does the program cover that? Is that an out-of-pocket expense on my end?
No, the grant covers everything, including your office visits, your mammogram. So they ordered a screening mammogram. There's nothing found on your breast exam. It was just screening, routine screening. If it comes back and it shows that you need additional testing like a diagnostic mammogram or an ultrasound, the grant covers for that too.
Okay. That's great.
On your diagnostic mammogram, if they see something that's suspicious that needs a biopsy, The grant covers the biopsy as well. So everything is taken care of up until you receive a cancer diagnosis.
Gotcha.
Once you get a cancer diagnosis, then we enroll you in a special type of TennCare. It's called presumptive eligibility, so that we can get your treatment started as soon as possible.
Gotcha. So is this just a program for residents of Madison County or surrounding counties as well?
No, every county has a coordinator. Most of them are located at your local health departments. The only one that's not in the health department setting, but it is across the entire state of Tennessee.
Oh, great. Okay, cool.
So also every year, Kirkland Cancer Center has a free breast screening for women that are uninsured. It's typically in October. I think last year we actually got to enroll around 70 women.
Oh, wow.
So if you're not having any issues and you just need an avenue to get in the door, you can always sign up for that event when that comes time. But if you are having problems, definitely call Christ Community or myself, and we can get you an appointment to get you looked at as soon as possible.
I'm glad we're talking about this today because I know women's health is very important, and I'm glad you're bringing more awareness to this program.
Yes, as a mom myself, we typically tend to take care of everyone in our family and put ourselves on the back burner. And women's health is huge, not just in Tennessee, but across the entire country. And this program is there to help these women get the care in a timely manner and be taken care of. Because at the end of the day, we've got to put ourselves first sometimes so that we can be there for our families.
Even if you don't have insurance, this program is available to you.
Yes, absolutely. That's what we're here for, is to help the people that feel like they can't get help because they don't have insurance or the funding. And that's what we're here for.
I've done several podcasts with several doctors, both at Kirkland Cancer Center and elsewhere, and I've learned that early detection is almost the key in being able to beat cancer.
Yes, it's the gold standard.
Yes, so don't hesitate. If you're having issues, if you have concerns, please give Adora a call. Her phone number is in the description of this podcast, and they can help you out.
Well, thank you very much, Will.
Thanks so much for coming in today,
Absolutely.
and this has been another episode of We Talk Health.